Okay. Good morning and welcome to our Caring for the Caregiver seminar. We're really excited to have everyone join us today for such an important topic on self-care, how to protect yourself while caring for someone else. Our presenter today, her name is Kimberly Montague, and Kimberly is our Quality and Compliance Manager here at Community Hospice. Kimberly has been a nurse for a little over 13 years. She graduated from Galvin College in Gilroy, California, and went on to receive her master's in nursing at the University of San Francisco. She's been with Community Hospice for a few years now, I think 2 or 3, Kim, is that correct? And previously has worked in various industries providing nursing assistance to labor and delivery. She was a clinical nurse leader. She's been a preoperative nurse, nurse educator, clinical educator. She's worked at our local colleges, providing education to nursing students. She's a public health nurse, emergency response instructor. She's written grants. She's a manager, and again is also our quality and compliance manager. So she's a wealth of information and knowledge, and is also just a joy to work with. So we're really excited to have her today. At this time, I'd like to inform you all that we are recording this presentation. So if you would like to be seen in the recording, you can go ahead and turn on your video. If you choose not to, that is fine as well. We know that you're here with us, and you're welcome to turn on your video and ask specific questions at the end to Kim if you have any. But we are recording this session. If you have any questions throughout this presentation, please enter them into the chat box, and we are happy to answer all of those questions at the end of the presentation as well. So with that, Kim, I'm going to turn it over to you. Thank you for joining us and spending this lunch hour with us. And if you have any questions, Kim, I'm right here in the background, so please feel free to ask at any time.
Okay, that sounds good.
Thank you.
Well, hello, everyone. Okay, well, we're going to go ahead and then just start this presentation with the first slide. Who is a caregiver? That's the question, right? And really, we all are impacted by the need for caregivers, and we become them. So there are only 4 kinds of people in this world: those who've been caregivers, are currently caregivers, will be caregivers, or will eventually need caregivers. So caregiving really touches every one of us. So a caregiver can be someone you're caring for. It can be a parent or a spouse, extended family member, even a neighbor or a friend. If you provide someone with transportation or to medical appointments, if you are purchasing or ordering their medications, monitoring their medical condition, communicating with their physician and the different agencies where they receive care, if you're getting them in and out of bed and into chairs and helping them move around from one place to another because they're not able to do it themselves without assistance, if you're getting them dressed or showering them and bathing them, or doing their shopping, either grocery or other kinds of shopping, preparing meals, or really helping them out with their finances. If you answer yes to any of these, then you are a caregiver. It shows you how extensive the role is, right, of being a caregiver. It's not just as simple as, making somebody a cup of soup. There's a lot to it. There are 4 areas of risk in home care that we are going to focus on today, and hopefully shed some light on it. And most of these things I think are pretty basic, but we think of other people as natural caregivers. We think of other people and forget to really focus on how caring for someone else might impact us. So the areas of risk in a home are muscle and bone injuries, strains or sprains, right? Exposure to risks, emotional and mental stress, and emergency and personal safety. We're going to dive a little deeper into each one of these topics. So first, muscle and bone injuries and strains. This is really common when we're caring for other people because often when they're needing care, they have an unsteady gait, meaning they can't walk very well on their own. They need assistance. They might hug a wall or need to have some assistive devices. So they might need help with transferring. So transferring the person um, that you are providing care for, transferring them from a bed to a chair, and rotating your back in that motion is dangerous for nurses aides, and anyone who's helping someone that they're caring for. Really using proper body mechanics is key. Carrying heavy loads, such as like full baskets of laundry or equipment or any heavy items for them, trying to assist them, then you put yourself at risk for hurting your own back or falling down or having a strain of some sort. Moving or repositioning the person that you're providing care for while they're in bed. This is really tough to have good body mechanics, even with a movable bed. So you need to make sure you educate yourself on the proper techniques of helping someone roll over or change positions while they're in bed. Lifting or moving furniture or other heavy objects. Maybe you're trying to clear the path for the person, your caregiver, that you're caring for, so that they have a clearer path to the restroom, or maybe that can accommodate new assistive device equipment like a wheelchair or a walker. And in doing that, now you're becoming a furniture mover and you hurt yourself. So you want to be careful for these things. Bending and stretching while cleaning or helping a person that you're caring for while just doing their daily activities, their daily living activities. Even something as simple as brushing someone's teeth, if they are actually standing in front of a sink and you're trying to lean over and help them, you put yourself in not good alignment for your own back, and you can actually cause yourself to get a strain. It doesn't have to be a heavy object for you to strain yourself. Tripping in the home or walkways going up to a home. They may not really have a ideal, path going in. They might have obstacles like, garden things like little garden gnomes or decorative things, or they might just have a lot of clutter or even toys or things that you can trip on. So you need to be careful for that. And of course, in the home, you want to think of things like loose rugs and again, clutter or paper on the ground can trip anyone. So we want to be careful for that. The second would be exposure to exposure risks. Boy, we have all become somewhat of experts on this with COVID-19 and the current pandemic that we've been living through. So people have all learned a lot about airborne germs and how to protect themselves by wearing a mask. COVID-19 is not the only germ we have to be concerned about. So we want to, when we're caring for somebody else, going into their home, there are exposure risks involved. So if we're mindful, then we can protect ourselves. So again, airborne germs, bodily fluids. If you're caring for somebody that is not able to care for themselves, it will involve bodily fluids, just as the nature of giving care, if helping them toileting or helping wash them. Your eyes have tears, which are bodily fluids. You have wounds and things like that that have any kind of exudate or pus or anything like that, that's bodily fluid. So bleeding, anything like that, that could come up too. So we need to be mindful. Needle sticks or sharps, even if you're not the one giving the injection, if somebody that you're caring for has, maybe they're a diabetic and they give themselves insulin shots, they might not be as careful as they once were about closing the needle and making sure that it's protected before throwing them in the trash. So you could simply reach down and grab the trash to help them out and get poked if it wasn't disposed of properly. wounds, we touched about that. That's definitely something we would expose you to bodily fluids. Cleaning agents, because you are trying to clean effectively and kill germs. There's some really stringent um, cleaning agents that you might come in contact with, so always wear gloves. Pets, maybe they feel by you helping transfer this person you're caring for, a dog might perceive that as you're hurting them, and they could actually nip at you, or you could have an allergy to pets, or you're going to have some interaction probably if you're in their home. And also, one of the big trippers of people are pets. They love you. They want to come and meet you and greet you and kind of tangle you up around your feet, and off and down you go. So when I was an OR nurse, I did do total joint, and that means people that would break their hips and things like that. And I would say maybe the number one thing that people fell down and broke their hip, or needed major repair, was because they tripped over their dog. So be careful for that. Latex allergies are becoming more common. One of the things that they have learned is over long-term exposure to latex, allergies develop. So, but latex is a very medical friendly substance. So it is in like the toppers of medications and different things that just nothing else works as well. They try and limit it in a lot of OR suites, and in the hospitals, they try and go latex free as much as possible. But you might have some exposure to that. Secondhand smoke, if anybody in the home is smoking, you could get secondhand smoke. I would hope you protect yourself from that and kind of draw a line that you don't want to be exposed to that. Infestations of bugs. That sounds kind of scary, but it does happen, bed bugs, things like that. And I am very susceptible personally to like fleas or mosquitoes. I am better than a bug light. If you just take me camping, everyone else would be safe, and I would be full of bug bites. So they just love me. And that might be the case for you. So maybe no one in the home is getting bites, but as soon as you come in, they seek you out. They would do that for me. So you want to be mindful of that. Know that you are at risk for exposure to that. Hot and cold temperatures, depending on the needs of the temperature of the patient and their comfort level. They probably don't have very good regulatory control over their own body temperature. So sometimes you feel like you're in a sauna, and sometimes you feel like you're in the Arctic. But knowing that you can adapt and dress accordingly, or bring a sweater, or make sure you have layers so you can remove them as you go into the home to help, because you can actually become overheated and actually faint or have a problem, not feel well because you're overheated. Emotional and mental stress. Boy, this is a big one for people caring for other people. Working many hours and trying to do too much and too little of time. If you're the kind and compassionate person that wants to help other people and be a caregiver, you're probably guilty of this. And a lot of times people will work a normal job and then go home and be a caregiver after hours. Boy, that's a job on top of a job. So definitely, fatigue will set in, and this really can be cumulative as far as, all the other stressors of the job, and you're just tired, so you want to be mindful and know that you need to be protective of the amount of time you are actually working. Grief related to the person you are caring for, even if this person is not a family member, they're a friend or a neighbor. Just by definition of being their caregiver, they grow a dependence on you, and you become a lifeline to them. It is a very intimate relationship, one that you form a bond with, and you grow close to this person, and you care about them, and you have grief, like anticipated grief with this person, especially if their condition is one that doesn't have a good prognosis. So that can be very stressful. Abusive and challenging interactions with the person you are caring for, and other people in the home. So there's a saying that I say a lot, and that is hurt people, right? So when people are hurting, they lash out. It could be physical or verbal. And nurses are very in tune to this because everyone that's in the hospital or sick and you're caring for them, they're scared. They don't know they don't know if they're going to get better. They're fearful. And quite a bit when people are fearful and they don't exactly know how to process that fear or what to do with it, it comes out and expresses itself in anger. Also, some illnesses that that people get that they actually end up needing care for from other people involve becoming confused or disoriented. And one minute they recognize you, and the next they see you as an attacker. Just when you're trying to rotate, them into a better position, and they'll actually hit you or try and defend themselves. They see you as somebody that's going to hurt them. And medications, different medications people can be on can make them confused as well. So that, and on top of that, life stresses, finance, health, housing, transportation, childcare, and relationships. This touches all of us, right? But when we have all the life stressors and the other things, you can see the toll, the emotional and mental stress that can be adding up cumulatively in your life. So emergency and personal safety, we touched a little bit about this earlier on, but in our area, and certainly where I live, fires are a big issue, and power outage are both listed here in the fires, tornadoes, floods, hurricanes, electrical outages, and other events while you're at work. Those can put you in some, danger or, emergency and personal safety issues. Driving to and from work is always, it's always an adventure, and there's always some risk into that. And driving in, dangers in the areas around the homes, as I was talking about the pathways. Sometimes when you're going to someone's home, you're going into an environment that you don't have control over. And so it's not the way maybe you would have your path, but you kind of have to navigate around the obstacles that they have in their pathway to their home. And some people like to collect clutter and different things. So you always want to be mindful. And violence in the homes. When you have been caring for somebody for a while, you start becoming part of, their landscape of their home. They start seeing you, and they let their guard down and start being themselves, which is great. You can make a connection, but if they're in an unhealthy state in their way they run their family and in their home, violence in their home, it could be verbal violence too. It can be very abusive verbal violence, and that's their norm. And now you're subject to that because now they feel comfortable enough to be their true selves. So you want to be, mindful, and you have to protect yourself. If you feel ever that violence is directed toward you, you have to put yourself and your safety even in front of the person you're caring for, and you most likely care for them. Not only are you doing care for them, but you care how they are doing, and maybe care for their well-being. So health and safety is so important because if you get injured or ill, you miss work, you lose your income, right? That's very scary. Most people that I know, at least that I am, live check to check. If we miss a check, it's hard on our family, and it puts us in really harm's way. So as far as keeping our life going in the way that it needs to, and so people, if you're sick, you can't work, and then that hurts your income level. You can leave the person you're caring for without support. So if you get sick or injured and you're the caregiver to somebody, that can really compromise their health, right? Because they don't have you and they need you. So it's really important to care for yourself. Strained backs, muscles create more risk of hurting clients. I don't know if you've ever had this experience, and as I'm getting older, I'm having a bit more of them, but you go to take a step and like your knee kind of gives out a little bit, and then you're like, oh, you catch yourself. I'm like, that's weird. That wasn't my normal gait or plan. And if you can imagine, if you have an injury, our brains are amazing and they compensate. So when we have something that's hurting us, it really tries to prevent us from putting our full weight on there. So now if you get, like, say you hurt your knee, but you think I'm okay, I'm going to make do. But then you go and you're now ambulating, which is walking with a person you're caring for, and just to make sure they're safe. And all of a sudden they start to maybe look like they're going to fall. So you then reach to help them, and they reach for you for that support. And then your injury rears its head and you lose your strength in your leg, and now you both go down because that person that you're giving care for depended on your body strength, and because you were working with an injury, it wasn't there to give, and so you both fell down. So you want to be super mindful of that. The person you are caring for will often worry about you when you're hurt or injured or sick. So you want to help them to be strong and healthy. And if they're overly concerned because you are also needing care, they will feel guilty to ask for anything. They will not want to bother you or lean on you, and therefore they're not getting the care they really need. Healthy and safety is so important because it's painful and stressful to be sick, or if you have sprains or strains or broken bones. We all know that, right? Getting injured or ill affects all aspects of your life. Even the smallest tasks now become large. My husband just had a broken leg, and you just take for granted jumping in the shower or going off to the bathroom or doing the things you want to do. And it's a real imposition to have a broken leg. And so you want to, remember that it's a long lasting injury that takes a while for your own body to heal. If you're sick, you can infect other clients or others. Sometimes if you're really dependent on your income, people might think, oh, it's just a cold or it's just allergies. And they don't want to let the person down that they're going to go provide care for, and they go to work sick. And of course, then that spreads to the person that already has some sort of health compromise, right? So we really want to be mindful when we're sick not to go to work and bring it to others. And I say go to work, it may not be your place of employment, but it is a job, right? It's a job maybe you're only being paid for, and good feelings and a sense of well-being and kindness, but it is a job to be caring for somebody. So that's what I mean by that. Home care workers may put their health and safety at risk because they hurry. They're trying to get too much done in too little of time. This is me every day. So always reminding myself to slow down and to, do one task at a time. I'm always multitasking. If you are taking on this caregiver role as after your other job, and then you probably have to go home and make dinner and clean your own house and get prepared for your other day. So you have a lot to do. And so tending to try and push a lot of things together, that does put you at safety risk, rushing, right? They don't want to let the person that they're caring for down, as I stated earlier, and needing the wages, pushes people to go into work or helping somebody when they're really not well themselves and could spread it to them. They haven't received the proper training, or they haven't been trained enough, to know how to maintain their health and safety. The internet is amazing. There's a lot of resources. And at the end of this PowerPoint, you are given some to direct you to, and I encourage you to look at them. Some of them are very basic pictures to reminding you of the good body mechanics and things like that that you need to really get to know, because this will save you from this, from that potential injury. So educating yourself on by going in and really looking and seeing what you should be doing for body mechanics is in cleaning and protecting yourself. That's really important. Workers' health and safety may also be put at risk because they put doing what the person they're caring for wants and their needs in front of their own health and safety. A person that they are caring for may want them to do things that aren't safe or treat them in ways that are stressful, and they haven't learned how to set healthy boundaries. That is a skill. And for me, that skill came with age. But when I was younger, I really had a difficult time saying no to things because I didn't want to disappoint anybody. But I do understand that setting healthy boundaries is what's best for me and my family. A lot of people depend on me. And most likely, if you're a caregiver, that's because you're used to caring for other people, and it's something that fulfills you. Hopefully, setting boundaries is very important. Saying, I'm not going to climb that ladder, or I'm not going to, I'm not here to clean your gutters, or anything else that, that's not, I don't feel safe doing that. Making sure you can be very kind, but simply say, no, I'm sorry, I can't do that for you, but I'll help you find somebody who can. Home care workers may put their health and safety at risk because they hurry. Again, that is a key. They're just kind of reiterating. They try to do too much in too little time. They don't want to let the person down that they're caring for, and they need their wages so that they work when they're hurt or sick. They haven't received the training. So this is just reiterating that same slide. They haven't received the training, so please go receive the training. I feel like we just went through that, so I want to go, there we go, let's press down. Okay, so tips for staying healthy and safe while providing care for others. You want to stay alert and get training. Never stop learning about the 4 areas of risk: physical strains, exposures, stresses, and physical and emergency safety. Speak up and listen constructively. Out of respect for yourself and respect for others, talk with the person that you're caring for and their families or their support systems to address concerns. Don't just hold it in. If you're concerned about something, you want to respectfully communicate your concerns to them. So more health and safety strategies. Use assistive devices if available. Sometimes people haven't acquired the assistive devices that they need. You might see that they're always leaning against a wall, using the backs of chairs to assist them as they walk from one place to another. If you see that, you might see that you need to ask them or help them select some assistive devices such as a cane or a walker. If possible, if you're in the selective process, you're going to have a keen insight to what they might really need. If they need a little bit of help, they might just be okay with a cane. If they definitely need more help and they are off balance, then they need a walker that they can take a break and sit on. You can always ask a physician or a nurse, and they can help advise you in order for you to give the proper advice to the person you're caring for. Learn about and use good body mechanics. I've mentioned that a few times. That is really key to protect your back. It's actually very common for nurses, nurse assistants to have problems with their back because of, jumping in and trying to help real quick and not using the proper body mechanics. Use of standard precautions. Normally we don't list a mask and standard precautions, but in this day and age, as of right now, even with this, things changing all the time, you're working with a client, you need to, at this point, keep a mask on for yourself and for them. Gloves and hand washing, you want to avoid exposures. Use approved containers for disposing of sharps and needles. Don't ever throw or allow the person you're caring for them to throw needles into a garbage bag, because somebody, from, the refuse workers that go and, take care of our garbage for us, then they become at risk. They grab those bags and throw them, and then they get stuck with a dirty needle, and that's not okay. So we want to make sure we dispose of sharps appropriately. Report concerns to the person you are caring for and the families or the supports or their support system. It's better to be open with your communication, and that will help you with your job satisfaction and feeling of well-being, and they will have a better, clearer expectation as to what you can do to help them. When you are communicating or talking it over with them, before you start that conversation, you want to plan your discussion, know what you're going to say and what the outcomes you are hoping to receive, right? So if you have a plan, usually it will go better. You want to be respectful, make a request, not a demand. Always use I statements. This is good for all of us in every conversation we're having. Instead of saying, you make me feel bad or you make me scared, you say, I feel afraid when this happens. I am concerned about this. That's a much better way to go and a better way to receive information. Describe what you observe and how it affects you rather than blaming the other person. Listen and see the issue from the other person's point of view. Boy, putting your feet in somebody else's shoes is a great gift, because as soon as you're able to do that, you're able to address people with compassion and understanding and give them more grace, right? So knowing your bottom line, simply that's setting those boundaries we talked about. If they say, I'd like you to work to midnight, and you cannot do that and function in your own life, have a timeline in your head before you start that conversation. 6 p.m. is the latest I'm going to stay. So you don't get into this negotiation. You can be kind but clear. I am so glad to help you, but I cannot work past 6 p.m. I'm sorry, that's not negotiable. And now it's clear, right? Don't forget to take care of yourself. Boy, that's a toughie for you caregivers out there, right? Most people that are caregivers naturally want to put others before them. Remember to take care of yourself. Get sleep. Boy, our bodies only repair, they only grow, they only process information, new information, while we sleep. Our body uses all of our resources awake to be awake, right? And learn and do new things, but it only like reboots and grows and repairs and gets healthy during sleep. Sleep is key. Exercise, always hard to fit in. There's a feeling like it's going to just make me more exhausted, but there's many studies that show if you just do a little bit of exercise every day, it does actually increase your energy level. And follow a healthy diet. We always know that's good for us. A lot of times when people are caregivers and they're fitting in more than one job and they're so busy, the real problem is they don't eat. They skip meals, and then they become fatigued and weak, and that can lead to a fall or other things. So make sure you get your meals in. Drive safely with your seatbelt on, of course, and no cell phones or texting or distractions. When you are a multitasker and trying to get a lot done in a day, sometimes your drive feels like the time where you can get those things in, and then you multitask on the road, putting yourself in risk. So try and always avoid that. take time weekly to plan and care for your own well-being. That's wisdom if we can do that, right? If you like to read or do puzzles or play with animals or visit your grandkids or whatever, even with your very busy schedule, you need to carve out some time and make you a priority and do those things that fill your cup back up, right? Engage others that are in your life to help you address stress. Talk it over with the people that support you. This is in my life, this is my mom. So when I am feeling, oh, I have to do this or that or get this done or this thing needs to happen, I call my mom and say, oh, I don't know if I can do it, or I'm stressed or I'm tired. And she's my person that listens and says, you can do it. You're doing great. I'm proud of you. And that just fills my cup right back up. So I certainly hope all of you had someone like that you can call, and just making that short phone call or visit really can recharge us. So I encourage you to make sure to do that. Remember, I was talking about those additional resources. Here they are. And so I would encourage you to look at, there's some good information there for you. And then it's time for questions. Does anybody have any questions for me?
Kim, great presentation. Thank you so very much. It's just wonderful, helpful information that I think everybody can benefit from. I don't see any questions yet. I do have several comments, so we'll just start there. Rena mentioned that your definition of a caregiver was great. So she said, great definitions of caregiving. We should all be ready to be a caregiver at any time. We have one that said good common sense reminders that you provided. And then many of these points can be applied to caregivers who are caring for family members in their home. Yes. And then just several thank yous. If anybody has any additional questions, please feel free to enter them in the chat box. You can also unmute yourself. You're welcome to ask him any questions directly, or you can even turn your camera on if you would like to for us to see you when you ask that question. You're welcome to do that as well. Just another thank you, very comprehensive presentation. Which I definitely would agree. Kim, if you wouldn't mind moving your next slide for me, that would be
sure.
helpful.
Okay.
All right, so I don't see any further questions at this time. So Kim, again, we just really want to thank you for your time. Oh, one other, wow, so many great suggestions. When I was a caregiver, I experienced very single point you mentioned. So maybe every single point you mentioned, I'm not sure. At this time, we'd like to invite all of you to join us for our next Caring for the Caregiver meeting that will be held on July the 8th at 11 o'clock. You can use the same link that you used today to join us. And that topic is going to be on what is stress, right? Stress manifests and comes in many different forms. So it's a great topic, and then helpful tips to manage stress, which I think we all have a little bit of stress in our lives. So I'm looking forward to all those great resources. So again, July the 8th, 11 o'clock, we welcome you to join us for that. And Kim, thank you again so much for taking the time to join us today. We really appreciate you providing us these resources. With that, we're going to go ahead and end our recording. Thank you.